discuss customer loyalty, we've really focused our efforts now on building a relationship with our patients, increasing that quality experience with our patients rather than the quantity coming through the door. Really what we like to remember when we think about our customers and patients is that it's not the employer who pays the wages. Employers only handle the money. It's the customer who pays the wages, and that's a fantastic quote by Henry Ford that we really go by in all areas of our organization, because if we don't have customers or patients coming through our doors, none of us have jobs. So we want to remember that when we serve our patients. We are all responsible for achieving our ultimate goal of building a model that attracts and retains the patients that we see. Our patients don't already feel well, so we want to go the extra mile to really make them feel welcome, really provide that overreaching experience that's going to make them come back to our clinics each and every time. Our patients and customers do have choices in healthcare, so we want to make sure that they choose us each and every time. One of our clinics here in Louisiana, we actually have a competitor in the same parking lot of our urgent care center. So our patients, if they come into our center and there's something that just doesn't strike them the right way, they can turn around and walk out the door, go into the competitor's facility without even getting into their vehicle. So as you might have noticed, we have urgent care centers popping up all over the country very rapidly. So our patients do have choices in their healthcare needs, specifically with urgent care. So we want them to choose us. 50% of our new patients come through word of mouth referrals. This depends on the area or the location that the clinic's in. If we have a city-based clinic like Baton Rouge, Louisiana or Indianapolis, Indiana, this number is going to be pretty accurate. If we get into more of our rural markets where choices in healthcare are very far-fetched, this number is going to increase closer to 75%. So again, this goes back to our social media discussion where we want that positive feedback coming from our patients, because that's going to be the processes in where we get our patients through that word of mouth referral. So some tips for establishing customer trust. We want to be efficient in order to minimize wait time and overall visit times. We want to smile when greeting our patients, give them that warm, friendly welcome to our facilities. We want to be proactive and ask how we may be of service to them. We don't want our patients to stand there and wait to be served or questioned. We want to go ahead and acknowledge them and ask how we can help them today. We do not want to turn away or walk away as a patient approaches you. The patient at the clinic takes precedence over someone calling into the facility. So if you're on the phone, simply put that patient on a brief hold, acknowledge the patient that has come into the facility, and start the process with helping them. We never want to judge a patient. All patients deserve our attention and respect. We want to leave all food, beverages, and electronic devices in the break room. This is a requirement from OSHA as well as our UCAOA accreditation, so we definitely want to be mindful of this. We do not want to discuss our personal life while a patient is in earshot. We want to avoid saying, "I don't know," unless you can add, "but I can find out for you." So help the patient. If you don't know the answer, that's fine. No problem at all. But we need to make sure that we find the answer for them or guide them to the appropriate person that can give them that answer. We want to be discreet if a patient's credit card is declined. And that's simply just going ahead and letting them know, hey, go ahead, you can step over to the counter, explain what had just happened, and if there is another method of payment that they would like to use. We want to make sure the patient has everything they need before leaving the clinic. We want to smile as you're saying goodbye and encourage the patient by saying something like, "Looks like you're feeling better already." Even if they don't, just give them some sort of positive encouragement as they leave our facility. We call every one of our patients back the next day to check on their condition of their visit. So simply just ask how their service was, if there is any additional needs. If a patient does request additional services from our facility, you simply put them on a hold and request that information from the provider. The provider, it's at his or her discretion if they would like to see the patient again, free of charge at a discounted rate, or if they would like to refer out to the appropriate person. The last thing is that we want to give patients more than what they expect each and every time. So how we build customer trust? Just by our presence and what we say and what we do through general interaction. We use our AIDIT training. So AIDIT stands for Acknowledge, Introduce, Duration, Explanation, and Thank You. So to acknowledge, which is the first letter in AIDIT, we're going to set the tone for trust in 90 seconds or less. This is just using your body language. So we're going to knock and ask for permission to enter the room. If you're at the front desk, you're just gonna smile and acknowledge them. And then you're gonna choose your attitude. So you wanna make sure it's a positive attitude each and every time. We wanna look our patients directly in the eye and we wanna point our body to them. That way they know we are fully focused on them, their needs, and their treatment processes. So again, acknowledge is just using your body language to start the trust process. Then you're gonna simply introduce yourself. State your name and your job discipline. Whether you're a nurse or a nurse tech, whatever the case may be, your name and your job discipline. As you get more experience with the facility or urgent care, if you have specific certifications, maybe specific to pediatrics, you might want to also say that anything that is going to help the patient's anxiety decrease during that time. So anything you can add to that. Then you're going to simply introduce your coworker. So a lot of times you'll come in with a coworker. A nurse tech will come in with a nurse. So you're going to go ahead and introduce the second person. The first person to speak is going to be the first person to start the treatment process. So typically the person that is going to start the vital signs. They'll be the ones to introduce themselves, and then they'll introduce the coworker, who's ever in the facility in the room with them. You're going to simply state their name and their job discipline, and then your coworker could chime in and add any specific skill sets or certifications that might help decrease the anxiety of the patient. Then we have duration. So we want to give our patients a sense of time. This is very important in an urgent care setting because oftentimes as we get into our busier seasons, they're going to experience a little bit of a longer wait time. So we want to avoid giving them exact number of minutes, 35 minutes, 45 minutes, because that kind of holds us to that time frame. We can use things like number of patients. So if they're sitting in a waiting room, there's 3 patients ahead of you. So that way our patients have something to look for. They can watch the patients be called back. It really just gives them that number without holding us to a specific time frame. We could also give them the time to complete a procedure or a test. A lot of that is predefined in each of the tests that we use in our facility. Time to complete a service or to see a physician. If we want to give them that sense of time for a physician, we don't really know what our providers are doing in the other rooms. Could be an emergency situation that came about. So again, we want to give that number but not the minute. So they're the physician's 2 rooms down, whatever the case may be. We might be able to provide the time to receive results, some feedback, or a solution to a specific problem. And then we want to give them an expected time it will take to leave. So we're not going to give them the number of minutes. We're going to tell them the physician will come in and then we'll go ahead and discharge you and you'll be out of here before you know it. So again, using words that are going to get them excited that it's not going to be much longer, but not holding us to the number of minutes. The next thing is explanation. So we're going to help the patients and customers feel better about the treatment processes. We're going to explain every single thing that we're going to do to them before we start treating them. So I always use the example of a strep test. So what you're going to do, what they're going to experience, so that they may have some gagging or feel nauseous, whatever the case may be, and how you're prepared for that. Let them know it is okay if they get sick, that you're going to be prepared for that. Allow the patient to ask any questions before you actually start treating. Once they feel comfortable, they're confident, they're ready to go, that's when you start the treatment processes. That way everyone's clear on both sides. You're prepared as well as the patient. And then the last thing is thank you. So simply thank the patient for entrusting us in their care. Each and every time you come in contact with our patients and you leave them, ask if they need anything and simply thank them. Each and every time we work with our patients. So as we mentioned, we talked a little bit about the Press Ganey Patient Satisfaction Survey System. This is very important because this really guides us not only at a management level, but also for you guys in the clinics. Maybe your patients are sometimes brutally honest and will tell you exactly how they're feeling at point of care, but a lot of our patients will tell us their experience after the fact. So this allows them the opportunity to express their feelings about their care in a confidential manner. Their names or any of their PHI is not included on Press Ganey, so it's completely anonymous. We will provide the information on the provider because it's going to be the same answer each and every time. We do ask about the wait time experience. So this is specific to the time that the patient has completed their paperwork, they've turned that into the customer service rep, to the time when they're called back to start the vitals process. So that time, we want it to be less than 15 minutes. That's what we're shooting for. The knowledge and care from our nursing staff, that's everyone in the back that is not a provider. So our nurses, whether they're an LPN or RN, rad techs, nurse techs, medical assistants, anyone that's in the back that is not a provider. Then our courtesy of our front office staff, the cleanliness of the clinic, the opportunity to recognize a staff member, and the likelihood of recommending that specific clinic to others. So the great thing about this system is if our patients select some sort of negative feedback, so for instance, the cleanliness of the clinic, if they say the facility was not clean during their visit, a comment box is going to drop down and ask why. Why are they saying our facility is not clean? Because we want to know. We need to know that feedback because we need to make that change. We're able to comment what happened, and then once the patient fully submits the survey, if a negative response has been selected, an alert is going to be sent to our management team, so your direct supervisor. In that case, your supervisor is able to call into the clinic and state what has happened, what the comment was, and you're able to fix it right away. So it's a great opportunity for us to nip a situation that might be ongoing if we didn't have this system in place. So very great feedback, not only for our management team, but also for our employees. This is the workflow process of how we go through the patient satisfaction. So upon discharge, our clinical staff member is going to escort our patient to the checkout counter. At that point, the clinical staff member is going to go ahead and select the provider on staff, because again, that's the same answer each and every time. So we'll go ahead and answer that for them. Then the clinical staff member is going to prompt the patient to finish the rest of the survey by saying, "Sir or ma'am, can you please take a second to answer 5 quick questions about your experience today," while you're going to name the customer service representative processes your paperwork. Then the clinical staff member will thank the patient for agreeing to complete the survey. Some patients might not want to complete the survey. That is fine. We request at least 50% of our patients to complete the survey on a daily basis. So if 1 or 2 don't want to complete it, we're not going to force them. But again, we're going to hope that they're going to agree to complete the survey. So the clinical staff member is going to thank them for that. They're going to provide well wishes to the patient and thank them for choosing that specific clinic. If needed, the customer service representative will assist the patient in completing the rest of the survey, whether that is to work the iPad because they are on iPad minis in an OtterBox, so maybe they need assistance with using the iPad or reading, whatever the case may be, they're going to assist. This will also afford the opportunity for the customer service representative to collect any payments, print receipt, and also provide well wishes to our patients and thank them for choosing our specific clinic. So really the bottom line of customer loyalty is that we will strive to make our patients our highest priority by working to meet the standards that you expect. So think of it from you as a patient. What do you expect when you go into an urgent care center, or maybe not even an urgent care center, just a healthcare facility? What services do you expect? What respect do you expect to receive from the employees working? As a member of our team, you are the face of our company. Your actions do decide our future, and we expect for you to represent us well.